Welcome to San Diego's most popular local morning news. Good morning, San Diego.
Good morning, San Diego. I'm Bridget Naso in for Sandra today.
Yeah, and I'm Dan Plant. Thanks for joining us today, Wednesday, June 17th.
And there's a brand new surgery center at Alvarado Hospital, and it's very high tech.
Yeah, the doctors there say it's going to help folks a lot with the recovery process. And Lene Lewis is out there right now at the hospital. Good morning.
Good morning, you guys. It is a very exciting day out here because this new facility is going to help a lot of people in the community. And here with me this morning to tell us all about it is Dr. Ted Mazer. Doctor, thank you so much for making time for us this morning. I know that you're very busy, but this is really exciting. Tell us, what is it about this facility that's going to make a big difference in our community?
Well, this facility is going to extend the ability for patients to get outpatient surgery, high quality, high class, personal touch, in an area where we already have a very tight schedule in the main operating rooms that's forcing people not to have their surgeries when they'd like them. This is just an additional service that we can provide here for the local community, and something I think that they're going to get a great deal of benefit from.
And we were talking about this earlier, the fact that this is an outpatient center, but you guys have advanced technology that enables you to do more surgeries than you've been able to do in the past, is really also going to help getting a lot of people through surgeries that they need, and they won't have to wait to do it.
Correct. We're going to be opening shortly, and we have some of the newer facility equipment that allows us to do CT-guided surgeries that a lot of outpatient surgeries are not doing, minimally invasive spine surgery, a lot of things that are just at the forefront of outpatient surgery.
And when you say CT-guided surgery, what exactly does that mean?
Basically flying by a CAT scan. We can actually see on the CAT scan where we are within millimeters inside a patient.
Okay, so we're taking a look at this new surgery room, and Mike is showing us some of the equipment in there. What is it? What is in here that is high tech that perhaps might not have been here before?
Well, at the moment you're looking at some very standard equipment. There will be other things brought in, towers that have the CAT scan information on them, computerized systems, endoscopic equipment, balloon sinuplasty, things that are not visible here, but they will be there at the time they're needed.
And doctor, the fact is that a facility like this is really needed in our community because there are a lot of folks who need surgery. Give us some perspective on how important this is.
Well, if you remember just a couple of years ago, there was a question whether this campus would exist. Not only will the campus continue to exist as promised to the community, but we're expanding the services we can provide to the community.
And one of the things that you will be providing to the community in the near future is helping out with a local charity called Becky's House. Tell us a little bit about what you'll be doing for them.
Becky's House is the beneficiary of some of what we're doing here. We are raising funds from them with a raffle tomorrow night during the opening ceremonies. We are also going to be offering them about 12 surgeries for their beneficiaries, the women and the children who have been in abused households, etc., giving them access to care they may not otherwise have been able to get. And that will be free surgery and necessary medical care.
All right, helping out in the community in different ways as well. Let's head on back down this hallway as well. We were just in a surgery room, and what we have over here, you were saying, is the recovery area. And you like this because it allows for privacy, but doesn't feel so much like you're in a hospital.
I think that's one of the great things about outpatient surgery. We're doing more and more outpatient very safely, and that's becoming a very big standard of moving things out of the hospital. If you're a child or even an adult and you don't want to be in that large environment of a lot of ill people and people being taken care of for very advanced problems, this gives you a very personal touch. There's private rooms before surgery. You walk into surgery. We have one-on-one nursing out here. Not a very big facility, not a lot of people doing a lot of things at once. It's very much one-on-one and personal care.
And that one-on-one personal care helps a lot, as you said, in recovery. It makes you feel special, like you're really being comforted and being paid a lot of attention to. We need that when we're sick, right?
Not just from recovery, from the time you enter to the time you go home. And yes, we need that to get through some of the scary things like surgery.
That's true. And tomorrow, also, you're mentioning there's a reception at 5:30, and people in the community can come and take a look at this facility if they want to.
Absolutely. They should see what we have to offer and what's here for them.
Okay. Doctor, thank you so much for talking to us this morning. I really appreciate it. And congratulations on this beautiful facility.
Thank you.
It's very nice. So you guys, tomorrow at 5:30, there's a reception here. You can come check it out, have some food, and also buy some raffle tickets. It'll benefit Becky's House as well. Back to you guys in the studio.
Yeah, that's a nice, cool side benefit, that's for sure.
Thank you, Lene.
Thanks.
You're welcome.